A patient comes to the clinic and says, Doctor, I can't spread my fingers properly and grip has become weak, and my ring and my little fingers are bent like a claw. What now do you think is injured? The answer is the ulnar nerve, often called the musician's nerve because it's essential for finger movements. But when it's injured, even simple tasks like holding a pen, buttoning a shirt, or typing become difficult. In the next 10 minutes, I will explain the ulnar nerve from its origin to its course and its branches, muscle supply, and sensory distribution, and clinical conditions like claw hand and ulnar tunnel syndrome using easy diagrams and high yield anatomy points. By the end of this video, you will never forget the ulnar nerve for the MBBS exams, viva, NEET PG. So let's begin. Ulnar nerve runs along the medial or ulnar side of the upper limb. Where is ulnar bone? There is the ulnar side of the hand, and there is a ulnar nerve. Root value of the ulnar nerve. It is the base of the brachial plexus. Ventral primary rami of spinal nerve C8 and T1. It also gets fibers from the C7 from the lateral root of the median nerve. You can see in the brachial plexus. Branch of the medial cord of the brachial plexus C8 and T1. The course of the ulnar nerve, step by step. First, we will see in the axilla. Axilla ulnar nerve lies in the axilla between axillary vein and axillary artery. Between those, axillary vein and axillary artery. Then in the arm lies medial to the brachial artery. Brachial artery is a continuation of the axillary artery and then runs downwards along with brachial artery in its proximal part. Then at medial of arm, it pierces the medial intermuscular septum and lies on its back. Remember, in the middle of the arm, it pierces the intermuscular septum and lies on the back side. It descends on the back of the medial epicondyle of the humerus, where it can be palpated, causing the tingling sensation on the back side. Next, we will see in the forearm. Ulnar nerve enters the forearm by passing between two hairs of flexor carpi ulnaris and lies on medial part of the flexor digitorum profundus. It is accompanied by the ulnar artery in lower two-thirds of the forearm. Here are the branches for the ulnar nerve, two muscular branches and two cutaneous branches. Flexor carpi ulnaris and flexor digitorum profundus, but it is in medial half only. And cutaneous branches, that is dorsal cutaneous branch and palmar cutaneous branch. Then at the level of the flexor retinaculum, ulnar nerve lies on the medial part of the flexor retinaculum and passes superficial to it along with the ulnar artery to enter the palm. For entering the palm, it lies on the superficial to the flexor retinaculum. At distal border of the retinaculum, nerve divides into two parts, that superficial and deep branches. At the end of the flexor retinaculum, it divides into two superficial and deep branches. At the palm, superficial branch is supplies palmaris brevis and divides and gives digital branches to the medial half digits, including medial half nail beds till the distal interphalangeal joints. And then the deep branch is supplied most intrinsic muscles of the hand, that are the three muscles of hypothenar eminence, fourth and third lumbricals, and fourth, third, second, first dorsal intersect and palmar intersect, and in the adductor pollicis. It supplies the intrinsic muscles of hand responsible for finer movements, since this nerve is also known as musician's nerve. This is the diagram for the ulnar nerve. This is the whole course of the ulnar nerve. So simple. Learn 2 times. And then this diagram is in axilla, no branches. Then in arm, in the middle of the arm. It pierces the medial intermuscular septum and goes backside. In the forearm, it has four branches, two muscular and two cutaneous branches. And here in the palm region, it supplies the hypothenar eminence, here interosseous muscles, palmar and dorsal, and end in adductor pollicis. It is so simple. In the next video, we will see the radial nerve. And finally, this diagram, see, this is the palmar, superficial and dorsal branches of the ulnar nerve. It is different from the medial to 1.5 part, and this is the dorsal 1.5 part of the lateral hand. If you like it, share, like and subscribe, and stay tuned for the next now. Thank you. Here are the two important clinical anatomies for the ulnar nerve, that is the partial claw hand and complete claw hand. In the partial, involving only ulnar and two digits as a isolated ulnar nerve palsy, and in complete claw hand, involving all digits and results combined ulnar and medial nerve palsy, both ulnar and medial nerve. Here only ulnar nerve, hence in the medial side is only claw handed like structures. Hence, next, what is the claw hand? The hand in the ulnar nerve position in will have the fourth and fifth fingers extended at the metacarpopharyngeal joint and flexed at interphalangeal joints. Here is the ulnar claw palsy position. In the image you can see.